So what have we accomplished so far in these very, very early months of establishment? The Act was establishing the organization occurred in October of 2011. Members of the authority were appointed in January. The bios and pictures of the members are on our the Performance Authority's website. They include a number of people that will be well known to people in New South Wales. Our chair is Patricia Faulkner. The deputy chair is John Walsh, you will know from New South Wales, and particularly his most recent role in helping with the National Disability Insurance Scheme, and his role as the chair of the independent panel, remember, in terms of reviewing progress from Commissioner Garling's review of acute hospitals in New South Wales. Also names familiar in New South Wales, Paul Torzello, Mick Reid. We also have Brian Stokes from Western Australia, David Philby, and myself. The members of the Performance Authority have had 2 meetings so far, and as a consequence of that meeting had set up already some advisory committees that are in place and will be meeting soon, most notably an advisory committee that will include jurisdictions with rollout of more advisory committees throughout the year. In the most recent meeting of the board, which was just last Thursday and Friday, we spent 2 days together, spending a lot of time on a facilitated discussion around the core composition for a first draft of a strategic plan, as well as a work plan for 12 and 13, and then beyond in terms of meeting the composition of performance metrics that are in that performance and accountability framework. We do know already that a phased approach will be necessary. So for example, in the performance indicators, there's a number of them that are in developmental phases in terms of information systems, and a number of them that are, we have mature information systems and are absolutely ripe for the picking around nationally consistent information and locally relevant indicators. So you'll see a phased approach. We've also bundled the indicators in a thematic approach, because I think that's just logical in terms of releasing information. If you've got a bunch of information, let's say in the area of healthy starts, as we do in the indicators for healthy communities, we'll be bundling those together to release them all at the same time. There will be some work over the course of the year in terms of my hospital's website, currently being governed and developed with the department and AIHW, and that will clearly transition to the Performance Authority this year. That work will underlay a data plan that we will be issuing in June with jurisdictions around the composition of data that's needed in 12-13 for reporting in that year, and also will lay the foundation for future data requirements in the coming years. We have done enough work across all of the performance indicators in the performance and accountability framework to determine that there's sufficient information in existing information systems and existing data flows to support publicly reporting in nationally consistent, locally relevant ways in 2012-13. So jurisdictions will be happy to know, as they will find out in a couple of weeks. So here's a tip. We'll be relying on existing informations and existing data flows in at least 12 and 13.